Hello and welcome. I'm here today with Dr. Hasan Ali, the top plastic surgeon for the month of February and March 2016 in Doctor's Choice Awards. Dr. Hasan Ali is a plastic and cosmetic surgeon with offices in Dubai, Karachi and Riyadh. He has vast experience working at his centers located in Karachi, Dubai and Riyadh, where he has performed several advanced body contouring and liposuction, including VESA high-definition liposuction procedures, 3D and 4D body contouring procedures. Dr. Hasan Ali holds a current license to practice and perform surgeries in UK, Ireland, Dubai, Saudi Arabia and Pakistan. He has a special training in body, face and breast aesthetic surgery. Dr. Ali has performed over 4,000 cosmetic surgery procedures and presents his research work on several international symposiums and meetings. Hello, Doctor, and welcome, and congratulations to you, Dr. Ali, on being the top plastic surgeon for the month of February and March 2016. How excited are you on winning this title?
It's a great honor for me. Perhaps this is very encouraging to know that how my colleagues they think of me. For any doctor who received any award, it's an immense pleasure. It's a feeling of a positive feeling of a positive and encouraging feeling for any doctor in any specialty, and I'm really honored and I'm really happy on this.
You have received great reviews from your peers in the industry. What was your first thought on Doctor's Choice Awards?
Doctor Choice Award is a great platform for the doctors. Peer review, always most reliable form of reference, and it's really strong and influential, and always beneficial for the doctors. I congratulate the team of Doctor Choice Award for giving doctors such an opportunity to share their thoughts, and this is not very helpful. This is not only helpful for a doctor image, but also useful for patients in selecting a particular doctor in a particular specialty. It's nowadays when there are a lot of doctors in each specialty. People are always going online and they're reading the reviews of the doctors, and this kind of award, this kind of platform is really helpful for selecting a doctor by patients, and also for the colleagues and of other specialty when they decide to refer to a particular doctor, they can always find out that the doctors who are top doctors or they have good reviews. They can always recommend these doctors to their patients.
What inspired you to be a plastic surgeon?
The reason of selecting a plastic surgery specialty was during my medical school, when I was doing the clinical rotation. I found out these reconstructive procedures, and especially visiting the plastic surgery department and seeing these especially the post-burn reconstruction and other road traffic accident cases that were dealt by the plastic surgeon at that time, and also the newly emerged aesthetic field, which wasn't very popular at that time in my home country. And so I wanted to opt to a specialty which was rare, where there was more challenge, where there is an integration of other specialties like general surgery, urology, orthopedic surgery, but all other specialties have an aesthetic portion of which combines and form this plastic reconstructive and aesthetic surgery. and that was my main reason of inspiration. The other was obviously my dad always encouraged me, and he asked me to look into this specialty, and that was one very big reason that I picked this specialty.
What conditions are commonly treated by you, and what do you believe sets you apart from others?
The common conditions I treat, mainly my main practice comprises of body contouring surgery. I have been doing body contouring procedures for last 9 years, and mainly when I started after finishing my residency, I was mostly dealing with a lot of reconstruction that I've done in the beginning of my initial post as an assistant professor in one of the universities back home. Then later, my private practice was mainly dealing with the body contouring, especially the liposuction. So I purchased a system, Vaser, which is now considered as one of the gold standard in the liposuction. Though there are many other systems also there in the market, I started using Vaser, and this was very useful for me. And I have been doing Vaser for last 9 or 10 years, and that is my practice at the moment. Mainly comprises of procedures like liposuction, abdominoplasty, facelift, and also other procedures which are minimal invasive procedures, and that I also perform. Fat grafting is one which I've been doing very extensively, and every week I have patients for fat grafting. And I also perform fat grafting to the breast, which is also getting very popular, as a lot of patients, they do not like to go for implant augmentation for breast, and that is also one of my top procedures in my practice.
I understand you have performed over 4,000 cosmetic surgery procedures. What do you believe defines the term aesthetic?
As it often says, beauty lies in eyes of beholder. So it's not me who has to decide what patient wants, and it's always I want my patient to decide what they want. And aesthetic is a very broad term, and a beauty, and beauty can be variable among the different nationalities, different races, and different color. And this is like I deal with patients of different. My main practice comprises in Dubai, and we have over 200 nationalities they're living here, and I have been operating on different type of people with different aesthetic concepts, and it's really challenging, and at the same time it's really interesting that you see people of different origin, different types, and as I deal with the body contouring in certain part of the body where one type of race, they don't like the fat there, the other person may like that part. So it's you have to deal with what patient wants. So I listen to the patient. I want my patient what they want, and I first I listen to them, and then I decide what can be done. And it's always the patient choice. Sometimes as a doctor, you can always say no to the patient, but patient always seeking an advice of a doctor. So patient selection in our specialty is very, very important, and aesthetic or beauty depends on various factors. So it's a doctor's aesthetic responsibility to choose the correct patient and to perform the right procedure.
You have developed a fame with the liposuction procedures for body contouring and has performed several complex procedures for both women and men. Can you elaborate more about these procedures and its benefits?
Vaser liposuction is basically, it's a third generation ultrasound. It helps in disrupting the fat cells, and these fat cells can be removed from the body with the help of certain specified cannulas, which are gentle, and they do not disturb and damage certain important structures like vessels, nerves, and connective tissue. And the other very important thing with this type of tool is to give the skin a contraction, and that's why we see a lot of skin contraction after the liposuction, which apparently is not that obvious with the traditional methods. Patient can also go on the same day. It is less invasive. It leaves less bruising to the patient. So the recovery to back to the work and result wise, it's much more faster. So a patient can go back to normal routine activities right after a day or two, and then they can resume all other activities within a week time. There are other benefits of using Vaser is other than liposuction, that you can also combine it with other procedures like cutting procedures like abdominoplasty, brachioplasties, and even body lift procedures. And the very important thing I should mention here is a pad grafting. An old method of ultrasonic liposuction usually kills fat cells, and as this is an advance it has a minimal amount of ultrasonic energy, it does not kill the fat cells, it does disrupt the fat cells, it doesn't emulsify actually the fat. So the fat cell is still alive. There are certain studies which are published in the literature. You can see that the fat cells are viable and that can be used in a fat grafting to augment areas like buttocks, breast, and even on the augmentation of certain areas in the face.
Do you believe collaboration and networking among doctors through services and programs such as Doctor's Choice Awards play a significant role in the success of the modern medical professional?
Yes, the patients pool, the patient which are seen by one type of doctor, one specialty of doctor, can be correctly referred to another good quality doctor. And this platform of the Doctor Choice Award is an excellent source for patients and doctors both, as these patients can be transferred or referred correctly to the doctors who deals with certain specific problem. For example, if a doctor is good in nose surgery and he develops a fame with those type of surgery, these doctors who are already on this platform can refer the other colleagues to certain doctors. So it's very helpful, and I would say the quality of work it can be increased with such type of organizations. And so I congratulate the DCA for developing such a platform.
Lastly, what are your future plans, Doctor?
My future plan is basically to establish a good quality patient care and a good quality patient service in plastic surgery, where patient can have access to a daycare surgery and a minimal invasive surgery. I'm in a process of establishing such a unit which will provide a safe, effective, and targeted population of the patients which are looking for certain super specialty of plastic surgery, the service which I provide at the moment, so that the patient, they can come from anywhere or from any part in the country or outside the country and get the best service from me and my team. And my message is basically is that we treat patients with delicacy, efficiency, and with respect. Thank you.
Thank you, Doctor, for being with us, and I hope we meet again and do another segment like this. Thank you very much.